Hi everyone, my name is Delaney Rose, and I'm going to be doing my presentation on A Broken Healthcare System by Janine Interlandi. So, the crux of Janine Interlandi's article is on the question, why doesn't the United States have universal healthcare? So, she has this quote in the end of the article, and it really does tie in her argument. So she says there's never been a period in American history where the healthcare of blacks was equal to that of whites. Um, and that really does date back from the time of the Civil War. And it does carry on into the 21st century. So, to start off, smallpox was a really big problem during the time of the Civil War. It was impacting Americans, but even more, it was impacting white Americans. And Americans had this fear that African Americans and their epidemics would start to impact their own communities. So they wanted to try to eliminate the spread of smallpox. And by doing this, they had this idea that the black people as a whole, they needed to be wiped out. Um, and this really was the start of the mentality of how Americans perceived African Americans, not only through slavery, but through the unfair treatment that they would allow them to endure during the Civil War. So, in the 1940s, there were healthcare policies that excluded African Americans. So, the American Medical Association, they did not want African Americans to be admitted into medical school, which in turn that limited the amount of Black nurses and Black doctors in a hospital. And that ultimately meant that there was a lack of the representation, not only in healthcare, but also for the patients. And when it comes to the Affordable Care Act, um, it was um, made in 2010, and even though it did help to end some of the racial disparities in the United States, it really didn't have as big of an impact as it should have. And so, even though it had intentions of helping, not all states did the best job of really enforcing the Affordable Care Act and making it available to African Americans. The next question is, why is there medical inequality for African Americans? African Americans have always experienced the vast differences in healthcare treatment. There really is a lack of basic care, and they are not always taken seriously during hospital visits, whether it's an emergency visit or it's just a basic checkup. They are often overlooked and are seen as being over dramatic, and that's something that is still a really big issue in this country. Um, Even though there's been a lot of progress made, that's an issue that's really hasn't been that big of a difference for African Americans. So, to start off, the history of inequality, even though it does really begin with the Civil War and even before that with slavery, in the 20th century, the Jim Crow laws were really big in the United States. In 1931, there were 25,000 medical board specialists, but there's only two African American who were medical board specialists. And even more, in 1938, African Americans only made up 0.3% of the American Medical Association. And because these numbers are so low, there really was a lack of the representation and there was inequality in hospitals. So there really is a dark history of the medical experimentation. it's ironic because it does tie into the 1619 project, because Thomas Jefferson was one of the founding fathers. However, he did use hundreds of slaves for untried vaccines, and there were a lot of risks, and African Americans were seen as the ones that were able to be tested on because their lives were not as important as the white people's. There's also anatomical investigations, and there's a lack of knowledge on what was being injected into their bodies. And one of the biggest experiments that happened was called the Tuskegee study of untreated syphilis in African American men, and the experiment, it left 400 men with syphilis untreated, so that the doctors could study the disease furthermore, and didn't do anything to help them. And this was just the one example of the amount of medical experimentation that was performed on African Americans, um, not only during the time of the Civil War, but also during the 20th century as well. So there really is a question of why is there a lack of access to healthcare? So one of the biggest things is that Medicaid is viewed as welfare. African Americans are seen as the undeserving poor. African Americans are seen as lower class citizens, especially if they're on the Medicaid. And 85% of African American non-elderly adults are not Medicaid covered. And then here I just have a video. I won't play the whole thing, but I'll just play a snippet.
So I'm just gonna go ahead and. Oh yeah, the Power Match quiz was scary. Compared to white Americans, Black Americans die prematurely from all types of diseases. George Floyd, Trayvon Martin, Ahmaud Arbery. These have all become household names, but for all of the wrong reasons. Hearing about a Black man being shot by law enforcement in the United States has unfortunately become the norm. What cell phone cameras and surveillance footage fail to capture are the injustices spread out across all the various sectors of our society. As an emergency medicine physician, I practice in facts. And the fact is that compared to white Americans, Black Americans die prematurely from all types of diseases, including diabetes, hypertension, strokes, and of course, COVID-19. A recent study by Cigna found higher rates of childhood obesity, cancer, diabetes, and heart disease amongst Blacks, linked to the lack of economic resources, limited access to care, delay in treatment, and lower health literacy rates. Even
So why is there a higher death rate? So between the years of 1991 and 2000, more than 865,000 deaths could have been prevented if Black people had received the equal care. So also the Black people, like I was mentioned in the video, they are known to have higher rates of hypertension and diabetes and kidney disease. And also I saw this picture here. It says African Americans are more likely to die at an early age from all causes, which is pretty shocking. So why are African Americans being skipped? There really are three main reasons as to why they're being skipped, but the first one is called perceived discrimination. African Americans are more likely to face discrimination during routine visits compared to white people. African Americans are more likely to be just perceived as lower class, regardless of their socioeconomic status, only because of the color of their skin. They're also perceived to be lower class, and they're also seen as being over dramatic a lot of times. And again, I have a short video here.
At Aspen Dental, today is the day to take back your smile. Why wait? Save 20%.
The racist photo in the medical school yearbook page of Governor Ralph Northam of Virginia has probably caused many physicians to re-examine their past. We hope we're better today, but the research is not as encouraging as you might think. There's still a long way to go to improve how the medical field treats minority patients, especially African Americans. That's the topic of this week's Healthcare Triage. A systematic review published in Academic Emergency Medicine gathered all the research on physicians that measured implicit bias with the implicit association test and included some assessments of clinical decision making. Most of the 9 studies used vignettes to test what physicians would do in certain situations. The majority of studies found an implicit preference for white patients, especially among white physicians. 2 found a relationship between this bias and clinical decision making. 1 found that this bias was associated with a greater chance that whites would be treated for myocardial infarction than African Americans. That study was published in 2017. The implicit association test has its flaws. Although the authors maintain that it measures external influences, it's not clear how well it predicts individual behavior. Another bigger systematic review of implicit bias in healthcare professionals was published in BMC Ethics, also in 2017. The researchers gathered 42 studies, only 15 of which used the implicit association test, and concluded physicians are just like everyone else. Their biases are consistent with those of the general population. The research.
So number 2, there is this medical mistrust, and with the culmination between the medical mistrust and the poor communication and the discrimination, there really is a distrust of the medical professionals, and there's a fear of not being taken seriously. And then there's also poor communication. There's a lack of communication between African American patients and their doctors, and they are less likely to be believed compared to other races, like the chest pain. So in conclusion, there really does need to be healthcare for all, even those who cannot afford it. And I think there needs to be stricter laws that specifically protect African Americans from unfair medical treatment. But even though in my community, I'm not really sure of the racial disparities that do go on. I do live in a very, very small town, and I don't know how many African American people are even in my town, nor in Worcester as a whole. But there does need to be steps in place for African Americans so that they can have longer lives. They can, be a lot safer and know they're going to be okay if they want to go to the doctors and actually be taken seriously. Thank you.